am now.
Okay.
Hi, Mila. Hi. Oh, there's Dr. Hollister. Hi. Hello. Cool.
Good morning.
I'm just giving, there's still a couple people hopping on. I'm going to give everybody a little bit longer to join since it's not technically 7 a.m. yet here.
Oh, that is early over there. It didn't even register how early it is in Hawaii for all the mamas over there.
Yeah, it's kind of wild. Everyone else, I think you guys are like later morning and afternoon now, yeah?
Yeah, it's about 12 here.
It's 11 here. Yeah.
Lunchtime.
Just about.
All right.
Got your snacks?
It's 1 o'clock here, and it's sweltering. I'm outside.
Sweltering.
We'll see how this goes. Can you hear me okay? I have my headset on, so I can't. Everything sounds a bit muted.
Yep, you sound
Good.
lovely.
Okay, good.
Cool. Well, it is the start of our amazing virtual wellness retreat week. It's been a long time coming. I know a lot of us have been working hard on this and just so excited for it. Today, we're going to jump into
Oh my gosh, Devonia's right there.
where How to Thrive Postpartum came from, and the story behind it, which I think a lot of us will be able to resonate with. It's motherhood. It's amazing how being a mom can inspire so many different things in us that we never knew existed, and at the same time pull out bits of us that we kind of wish never existed. So that's kind of where Thrive Postpartum came from me. If you don't know me and you're just hopping on here, I'm Kirsten Holland. I'm the creator of How to Thrive Postpartum with my beautiful best friend, Danica Donnelly. And after I had my babies, I suffered from postpartum depression really severely, though at that time I literally had no idea what I was going through. Even the second time around, because the second time around it felt completely unique and different to my situation and different with having another child involved and wanting to make sure that I could divvy up myself to everybody. I felt like I was just pouring out from a completely empty vessel. And that, for me, postpartum depression usually lasts until my babies are like 6 to 7 months old. And then I start like feeling that weird cloud lifting. But after I had my son, he was my second, and I felt that cloud lift. I was like, okay, that's enough. I want to do something that helps moms know how to navigate all the nitty-gritties of postpartum and not feel like we're just kind of floating through it. I want us to thrive postpartum, and that's kind of where this birthed from. And I started chipping away at it, but then my friend Danica and I met, and it was like a match made in literal heaven, because she came and she was like, I'm going to help you. I'm going to help you make this like really awesome. And her coming along has just made this way more than it ever could have been. So she's amazing. You'll get to hear from her in just a second. So yeah, today is exciting because we're going to meet everybody who's going to be speaking this week. It's going to be kind of an intro to who they are, a little bit about their motherhood, and then the topics that they're going to be speaking about. And we're going to go through that. And then after, in about 30 minutes, we're going to have our first speaker, which is Jenna Clarke with Malama Momma. She's going to be talking about infant sleep training, which I am excited to have kick off this retreat, because if no one's getting sleep, ain't nobody happy. So it's going to be really good. Let's see here. I'm going to pull up our retreat schedule, and then I'm just going to introduce everybody in order of how they're going to speak. I do not think Jenna Clarke is on here because she's probably preparing and or still sleeping. because she's here in the morning. And it's early. But I'm going to go ahead and have Danica introduce herself since she is my partner in crime. You know?
Yeah. So when Kirsten and I met, she was so passionate about the postpartum period and new mamas, and I'm a birth photographer and family bonding photographer, and so I felt like I prepared so much for birth, but then postpartum hit and it just kind of took me by surprise. And I mean, I'll share my story more during my presentation on Wednesday, but it just, through seeing friends go through postpartum and just feeling like they weren't supported enough, and just there were so many mental health struggles and so much postpartum anxiety and depression, and just not enough support. Like, we used to have these communities of women to help each other and to raise our kids together and raise the mothers together and have the wisdom passed down from generations. And our day and age is kind of more about like you can do it yourself, you can do it all yourself, and there's just so many pressures. So we just really felt like we needed to get together and bring the education and information from all these experts to help women in one place, so that I just remember like Google searching this and that and what's happening to my body, and trying to pull in all this information from Google and from friends that I knew. But we just really wanted to bring the experts together all in one place so that women had the support and the education. So that's the vision and mission behind this, and we're so excited to have everyone. And I'll be speaking because I'm not a doctor or anything. I'm a photographer, but I really work through my photography work to help people, to help their families connect and bond through the photos and through the photo experience. So on Wednesday, I'll be talking about how to increase the happiness in your home through photography. So yeah, that's my topic for Wednesday.
Thanks so much, Danica. I'm so, stoked. If you followed us on Instagram, all of those lovely birth photos and stuff are all her work. And she really is an expert in just creating memories. I remember right before we left Colorado to come back to Hawaii, we did a photo shoot with her. And it really is like a really precious memory for us. The photos, of course, are nice, but like it was an actual experience. So she is an expert in her field for sure. So yeah, I'm gonna go ahead and allow who's first in my queue here to introduce themselves. Shannon Kaufman, like I said, when we all met yesterday, is like our OG. She's been with us since the beginning and has stuck through strong.
Got here.
It's been like almost 2 years now of like trying to put all this together. So she's still here, still strong. And I'll let her introduce herself.
Hi, I'm Shannon Kaufman. Thanks for the kind introduction, Kirsten. It's been a fun journey. You're stuck with me. So I live in Colorado Springs. I have a private practice here called The Well for Women, currently offering counseling services here. And I also offer postpartum coaching to mamas who live elsewhere. And coaching kind of focuses, has a more wellness perspective to it. Counseling is a little bit more focused, some on the past, but on delving into the anxiety and the depression piece, whereas coaching can certainly delve into that, but is more helping with adjustment to motherhood, that self-identity piece, and so forth. So, and I decided to pursue working with women, specifically moms, after having the birth of my first son, which I will talk about more in my presentation, which will be on Saturday at 11:30 to 12. And I'm going to be speaking on self-compassion and the importance of giving yourself grace and self-compassion to help with postpartum anxiety and depression, or just that overall adjustment. I know for me, I was really hard on myself and wasn't always kind to myself during postpartum period. So I'm going to be touching on that. Thank you.
Yeah, I think that's a really important bit. Learning to be nice to ourselves and the self-talk is huge. So
Yes.
that's why Shannon was like the first person that I pulled on board. I was like, you have to be a part because I needed you when I was going through all my stuff and I didn't know where to look. But here you are now. So all our Thrive Mamas are really, really blessed to have you on board. And
Thank you.
yeah, you're just a wonderful human. So
Thank you.
all right. Next in my queue is Dr. Devon Yall. Do you want to go ahead and unmute yourself and tell us a little bit about yourself?
Yes, hello. Hi, I'm Devanya Bonamy. I'm a physical therapist and a yoga instructor, but I've been a physical therapist since 2007, so I'm on sort of my 13th, 14th year of physiotherapy. I trained in the US and I worked initially in cancer rehabilitation in a cancer hospital. So everything was related to cancer. And actually, it was through that experience that I learned that there were so many other things happening to patients after cancer treatment. So if you've had cervical cancer, anorectal cancer, any cancer within and around the pelvis, you're probably going to have issues related to pelvic floor dysfunction or issues with bladder and bowel dysfunction as well. So that was kind of like the process that brought me where I am today as a board certified women's health and men's health pelvic floor physical therapist. After living in the US for about 10 years and in Australia for about 2 years, I had decided to move back home to the Bahamas, and I opened my own clinic really for women's and men's health pelvic floor therapy. So my clinic is dedicated to pelvic floor dysfunction, breast cancer and lymphedema management, as well as prenatal and postpartum musculoskeletal pain management. And this clinic is really kind of about creating a space that isn't available anywhere else in the Bahamas. In the US, there are lots of resources available for women who are going through different stages of their life in terms of maturity and changes and hormonal changes, that sort of thing, but there's not necessarily that grace period here. And a lot of us are left to our own devices and to Dr. Google. So being available to this demographic is really important to me. And only through, I don't even know what sort of magic happened, but Kirsten and Danica found me in the middle of all of this pandemic stuff saying, hey, we like what you're doing. And, you know, just through talking about the motherhood experience, I have 2 children. My daughter is 5, Viva, hence Viva Physio and Wellness. And my son, Bodhi, is 2. He just turned 2. And I actually connected more with Kirsten because we talked about sort of the experience of having a doula available during that process. And it changed tremendously my perspective of being pregnant, of how women are perceived and, you know, what is really important during that process. And then having the clinical background, I also understood how to ready myself as well in terms of what should I be doing in movement, what should I be doing in feeling better and having that body awareness, because we go through so many weird dysmorphic issues in our brains of what we think we look like and what we actually look like. So, you know, having sort of the dichotomy, that image and the clinical kind of helped me through the first pregnancy, and also having this amazing woman, her name is, don't kill me, Maya. And I didn't have her for my second birth experience, but that first experience really helped me through the second one. So I'm always grateful to doulas. And so the fact that Kirsten's a doula and, you know, this whole experience is very sort of spontaneous. I love being a part of it. And I guess I've been looking for finding a partnership with different parts of this experience for a while. So I'll be talking about pelvic floor rehabilitation in that 4th trimester, which we don't get to talk about too much. So we know about the first 3, but in those first few weeks, months after you give birth, your body is still changing, you're exhausted, and you may be developing or noticing changes with regards to vulvodynia, pelvic pain, dyspareunia pain with vaginal penetration, because eventually you will be going back to your, regular sexual activity with your partner or your spouse. In addition to issues like pelvic floor dysfunction, that's the urinary incontinence and fecal incontinence, as well as the risk of prolapse. So I'll try to make it super easy to understand and, you know, very layman's terms, and keep it light. But there's a lot that goes on in those first 3 months after you give birth that we don't, like you said, we don't have that village anymore kind of helping us through that process. And hopefully I can connect some of the dots for you guys. But looking forward to it, and I'll be talking on Tuesday, which is tomorrow, at 11, no, not 11, at 1:30, because it's Eastern Standard Time and not Mountain Time and not Hawaii time. Okay.
We feel
Okay.
like hard time figuring out all the different time zones.
Okay.
We're like, okay, so add this, take this, but you're doing it.
Yeah.
I'm proud of you.
Doing it.
I'm so excited. It's kind of amazing how social media can bring so many people together. I think it's honestly how it's brought like me and Danica together in a way, and Shannon and I together, and you too, Devanya. So thank you, social media. It's good for some things, terrible for others, but great for this. So all righty. I'm going to move on to Jessie Truelove. She's like our newest member and just made this like a whole new exciting adventure all over again for us. So I'm so stoked to have you. I'll let you go ahead and introduce yourself.
Okay, hi guys. My name is Jessie Truelove. I am a postpartum and prenatal corrective exercise specialist. And so I do a lot of the same topics and maybe exercises that Devanya probably does. I don't have the clinical background, but I'm definitely part of your postpartum support group. And I will explain, sorry, my daughter's over here reading all of my notes, so if you hear that. But I'm going to be talking about my postpartum and how it kind of thrusted me forward into this mom trainer role that I've kind of taken on. I never really expected to be a mama trainer or worried about whether women are leaking when doing jumping jacks or coughing. I was a personal trainer and an athlete my entire life, and it wasn't until I experienced my own pregnancy and postpartum fourth trimester that I had to rethink everything I thought about fitness and what being strong meant. I was lifting and pushing a ton of weight, which I'm a small person, and so I was deadlifting like 255 pounds. And I realized at the time of trying to deliver my baby, I had no real knowledge of breath work or pelvic floor function, and I wasn't able to deliver my baby naturally, which led to a C-section, an emergency C-section, which led to all sorts of unexpected issues that I didn't even know was capable with the C-section. But I'm going to be talking about changing your mindset from a fitness or an aesthetic mindset to a functional mindset. I'm going to be talking about the social pressures that women are put under, especially now with the rise of social media, and how not getting your information from a qualified source can be really dangerous because women are vulnerable in their postpartum period, especially early. And I think talking about what fitness actually looks like in the fourth trimester is really important for you to grasp timelines and what is actually happening. Like Devanya said, a lot of stuff is happening in your pelvic floor during that period. It's not just, which is what we expect, because we get one post-op appointment after we deliver our baby and then we think everything is back to normal. So it's no wonder that women are experiencing a lot of issues in their postpartum period because it is just not being talked about. The mom is just not important anymore. After they deliver their baby, they get one appointment and that's it. And I feel like we can do so much better for moms, and that's what all of these professionals here are here to do for moms, is be that support group and give you information. And I feel like if women were more provided with the education and the resources, then be a little bit more smooth sailing. Postpartum is tough. Pregnancy is tough. Being a mom is tough. And so having a big support group of people that have also not only experienced a lot of the things that you're personally going through, but also having some professional advice for you to what you can really do to support yourself instead of Dr. Google. So I've got a lot of stuff to talk about, and I'm also going to be doing a little, I'm going to be doing a conscious core workout. We're going to be covering breath work and pelvic floor awareness, signs of intolerance. with intra-abdominal pressure when doing exercises, when trying to figure out what exercises are working for you and what exercises are not working for you, as well as tackling some posture assessment and some posture exercises, because moms get stuck in that either pregnancy posture, even in the postpartum period, or just completely rounded forward, taking care of babies and feeding and diaper changing and all the things. So that's what I plan on talking about this week. I've got 2 sessions. I've got one on Wednesday, or I've got one on Thursday and on Friday. So I've got 2 sessions.
Yay.
And that's it.
And that's it. That's a lot. That's so exciting. Yeah, in her second session, she's actually going to be showing some like takeaway moves that you can start practicing like right away. So that's super exciting. I love too that everyone's using this term Dr. Google. I've never heard that before, but it's perfect. I'm going to just, when you pop on, just like some Zoom etiquette, if you can mute yourself, that would be lovely. Let's see, who is next? I have Dr. Lindsay Hollister. Lindsay.
Okay. Hi, I'm so excited to be here. So my name is Lindsay Hollister. I'm a naturopathic doctor, and I have 3 children. They're age 14, 10, and 8. So I've been out of that postpartum period for a while, but it is my postpartum time that propelled me into this career. So I'll share more about my story on Wednesday, but essentially what made me decide to become a doctor was my postpartum experience left me feeling really alone, like I was the only one who truly cared about my children's health, specifically my 3rd child, because she had a lot of health issues, and I nearly lost her. And then afterwards, there was a lot of work that needed to be done to help her get better, and I was just not getting the advice that I needed. I was having to sift through information in books and, of course, on the internet, and I went to all the appointments that I was supposed to and saw all the specialists that we were supposed to, but I always left feeling worse than I did when I went in. And I thought, this is not how a therapeutic relationship is supposed to be with a medical professional. And so I often felt scared. I often felt confused. If I asked my doctors questions, I often felt belittled. And if I ever, questioned their methods, I felt like they were very condescending towards me. And so that's not how a doctor is supposed to feel. And so I really eventually realized that I wasn't the only mom that felt this way either. I talked to my friends, and they were going through the same sort of things with their doctors, and sort of starting to do a lot of research on their own. So, at the time I was working full time, and I was not feeling fulfilled in my career. And I started investigating, well, what would it take to maybe just get a certification in naturopathic, whatever, or homeopathy, whatever. And I learned that there was such a thing as a naturopathic doctor. I didn't know it existed. This was in 2013. And I thought, oh, there's someone who's actually medically trained, but practices holistic medicine. That's pretty cool. And there's only 5 schools in the world though. And one of them was in San Diego. So I had a chat with my husband and said, maybe later on in life, that's something that I could do. And he's like, why not now? Maybe it's time for a total life change. So we uprooted everything, and that was quite a process. And we moved to San Diego. Well, before that, I had to attend pre-med for a couple years, and then moved to San Diego, and I got my doctorate in naturopathic medicine. And then we came back to Colorado Springs, and I opened my own clinic called The Organic Cure. And so I focus on reaching those moms that need to have the power back and the confidence back that they can actually help their own kids. And so my practice is pediatric focused, actually. I really like working on behavioral issues and a lot of the common skin and digestive complaints that get written off or treated with, first line treatment tends to be pharmaceutical, and a lot of it can be treated with diet and lifestyle. And so I do a lot of that education with moms, and we see a lot of really great results in a short amount of time. We do lab testing that gives us information that we wouldn't otherwise have, like what the nutrient deficiencies are and why things aren't working the way they're supposed to. And then we address that specifically. So we get to the root cause. And it feels really good. Every time I have appointments with my patients, I feel more energized after working with them, because I see the light come back into their eyes when they realize they can actually help their child feel better and reach their full potential. So that's what I'm doing now. I've always wanted to work with moms, and by nature I do that by working with the kids. I'm really working mostly with mothers. So I've always wanted to educate on the postpartum period, because this is such a critical period for helping our child and propelling them into a healthy life. But it's also so important to replenish the mother's nutrients. And so I'm going to be talking mostly about that, what we can do in that postpartum period, the healthy first year, to replenish nutrients, replenish mindset, how to deal with some of the touchy subjects like intimacy with your partner afterwards, and dealing with those issues at a nutrient level and a lifestyle level. So it'll work really harmoniously with all the other things that these specialists are talking about. And I'm super excited to be a part of Thrive Postpartum, and excited to share this virtual retreat and put together a mini course and start helping moms.
Yes, Dr. Lindsay Hollister, we love you. She keeps telling me to call her Lindsay, but I can't do it yet, so I'll work on that. But it doesn't feel right. You worked hard, and I love how supportive your partner is, or was, and probably still is, to help you just pursue your dreams and feel like such a huge need, because we all know that we want our babies to be well, but you're able to help them be well and us be well, and it's so huge. And her topic, when we were like brainstorming what to do, when she came up with how to replenish your body in the first year after having a baby, it was like, yes, that is so needed. I feel like that's one of the biggest topics that moms are like not really knowing that they need to replenish their body, but feeling so depleted. So that's going to be so exciting. And we're so stoked to have you.
Thank you.
We're going to go next to Mihoko. She is a board certified lactation consultant and is just the sweetest human possibly ever.
Hi, thank you. I'm Mihoko Yakobon. I'm a lactation consultant as well as a registered dietitian. And so I've been a dietitian for about 15 years now. And I've worked at a hospital, Women and Children's Hospital. And being there as a dietitian, you cannot bypass talking about breast milk, breastfeeding when it comes to infant nutrition. So I was intrigued, just more that I learned about breast milk. It was just, it blew my mind. So when I became pregnant, I was, for sure, I wanted to breastfeed my child. And, but everything changed when my daughter came at 35 weeks, considered preemie. She had jaundice, tongue-tied, and my father was diagnosed with end-stage cancer at that time. So I was just kind of feeling depressed. I wasn't sure at that time, but all these things came crashing on me, and I was left there with bleeding nipples. And I'm like, I have all these knowledge, but I just couldn't figure out how to work, how to go ahead with breastfeeding. But that's when I really noticed, like, I have all this knowledge, but when I'm tired, when I'm exhausted, when I cannot think straight, you really need the support. And like Danica shared, I think our society nowadays makes us, think that we need to do it on our own. We have to be capable, confident, all of that. But we really need a village to raise children. And, I'm really grateful that I'm here in Hawaii, because Hawaii does offer that to a certain degree. But, that network that you have with moms or family, healthcare professionals are so important. And I learned I had a great pediatrician who was an advocate for breastfeeding moms. So when I wasn't thinking straight, when I was tired, she was the one who came to the hospital, told the nurses, you know, I know baby's losing weight, baby has jaundice, tongue tie, but we're going to give her a chance to just breastfeed this baby. And I was so fortunate that I got to not use formula for both of my children. And it was my dream to just really breastfeed my kids. So that's where my passion came, to really be that support for breastfeeding moms, no matter what their goal is, whether it's just breastfeeding for the first month or like, you know, do half and half, whatever their goal is, I want to be there for them. And I'm also Japanese, so I always go back to Japan every year. And they do a pretty amazing thing about like breastfeeding, therapeutic breast massage, and being a dietitian. They incorporate like you know, certain foods to eat and not to eat, and a lot of their philosophy comes from people's experience, not really evidence-based. I'm trying to put those two worlds together. What does the evidence say, but what is working in those Asian countries? So I'm trying to put those together. I do home visits. If mom needs a massage, therapeutic breast massage, I do that. Not for all moms, really depending on the case. You know, there's some situations where you don't want to stimulate the breast too much. So definitely educate moms about that. But my thing is that I want to empower moms. So I always try to teach moms and family members how to do the massages so that they're not feeling like, oh, I need to see this masseuse or this consultant so that my breastfeeding journey will go well. That's not true. They can do it on their own. So my passion is to empower moms and families so that they can have a great breastfeeding journey. So that's my story. I'll be sharing more about it on Thursday, I believe.
Yay, thank you so much, Mihoko. I'm so happy to have you on board. I love the story with what you experienced in your lactation consultant. It's kind of amazing how it just takes even just one person advocating for you and making you feel like, no, I can do this. I'm strong enough to do this. So that is basically what this whole retreat is going to be about, is advocating for moms. And that's what How to Thrive Postpartum is about, is advocating for moms, but all of us doing it. So it's overwhelmingly awesome. I'm so excited to have all of our professionals on here. Jenna Clarke just hopped on here. She's with Malama Momma. She's amazing. She's a birth doula, definitely one of the best on the island, but has recently moved to Kentucky and is back on the island now, which I'm happy about. We literally like share a fence now, and that makes me so happy. But she's gonna be talking about infant sleep training today, and she's just a wealth of knowledge. She's also an essential oils educator and one of my best friends. So I'm so excited that you'll get to meet her right now, and she's gonna dive into our very first full-on topic. And Jenna Clarke.
Yay! Okay, aloha. It's so nice to be here, and I can share my screen, right, with you guys? Okay, cool. Kirsten is probably hearing the garbage trucks. Oh, I have screen sharing disabled.
Let me try to fix that for you.
Okay, cool. But I think the garbage trucks have gone now. They're quite loud, and so like, okay, we need this to be quiet. All right, here we go. Ooh. Okay, sorry here. I'm just gonna try to get to my screen. Is that the right one? That's the right one. Nope. Zoom is so tricky with the moving around of these little control panel things. There we go. There we go. Okay, cool. And if I could just find the present button. There we go. Awesome. It's so nice to be here. Thank you, ladies. It's so nice to meet everybody. I'm Jenna Clarke. Yeah, like Kirsten said, I live in Kentucky now, but we're spending spending summer here in Hawaii. And I'm going to talk today about just infant sleep solutions. I've been kind of coaching people through different ways to get their newborns and infants to sleep over the last sort of 9 years, but formally more over the last 4 years as part of my business. I'm looking forward to going over for you mamas. I love the topic of this retreat and how to thrive postpartum. And I think sleep is one of the ways that we thrive, definitely, in postpartum. And it's kind of this elusive topic sometimes. So I'm just going to, hopefully my slides are working well, just go over sleep expectations. I'm just going to give a brief overview of, sleep, and then what to expect, and then some settling techniques and stuff like that. Just a very quick 30-minute overview as everybody is giving. But here's just some expectations about what babies need. So when you have your newborn, they sleep a lot. It's kind of, on average, it's a big range, 16 to 22 hours a day, usually in 2 to 3 hour chunks at a time. It's pretty erratic for newborns. They're still kind of getting things dialed in. It's not advised, though, and when I'm working with my clients, to have babies sleep for more than 5 hours at a time. Sometimes we call them, droopy newborns. They will just keep sleeping and sleeping and sleeping. But in those first, especially 6 weeks, we want to make sure that baby's metabolism is being established, and then mama's milk supply is being established. As they get older and transition into that infant phase, sort of 3 to 6 months, they sleep about 15 to 18 hours a day. We're starting to see consistent patterns developing, and they're usually, if they're on some sort of routine, you can kind of expect them to take 2 longer naps a day and then maybe a shorter one. Not all babies do that. Some like to take 5 short naps a day. It's kind of random. Sometimes babies have their own little personalities. And then most babies physiologically, if all of the feeding and everything is dialed in, physiologically they can go 8 hours overnight between that 3 to 6 month period of time, but not all of them do. And not all of them are conditioned to do so. Biologically, it's not normal for them to do that, but we as parents can shape and manipulate that process by implementing some things. Okay, newborns, again, random at first. Their circadian rhythms are taking up to 6 weeks to develop. Like I said, in that 3 to 6 month period, when they start moving into that, we are seeing a bit more of a regular cycle, but up until then, it's all kind of random. Light, darkness, sunlight, darkness is really important in helping to set and establish that. Feeding baby the breast milk that you're producing at the different times of the day, like that hormone release is really important, like prolactin milk at nighttime, that kind of a thing. Stress in pregnancy, all of these things can help to shape and impact a baby's circadian rhythm. So really in those first couple of months, we're just wanting to help to shape and condition that. So we don't really have much high expectations. People that sort of say, get your baby onto a routine, right away from day one. That's not really what they do naturally, because it's all kind of random. So I like to help my clients with managing expectations on what is normal biologically, and then what is possible. And I like to use the word sleep shaping and conditioning, especially in the newborn to age 4 months, because there's lots of stigma or connotation around like sleep training and that kind of a thing. So this is really what we're doing, is setting up optimal sleep environments and establishing the breastfeeding relationship, if that's what birthing person is choosing. Okay, and then again, lots of skin to skin, you can do the baby wearing to establish that relationship. There's so many things that go into their metabolism, but making sure that they have that set up, because that is so linked to their ability to sleep. And again, I already talked about that, but calories are one thing. You'll hear a lot of people think, you'll hear things in blogs and social media about sort of just pumping your baby up full of calories, or some people will supplement like with a bottle because they think, if I just like plump up the baby during the daytime, then they'll sleep all night. That's not everything. Like the hormones of the breast milk and everything have just as much to do with shaping that sleep pattern as the calories. The calories are important, and that's something that I work with my clients, is making sure that we establish that relationship and make sure that there's no feeding issues before we even talk about sleep expectations. And again, they can go safely 5+ hours by 6 to 9 weeks of age, but you want to just make sure that you're waking them to protect that. So there's lots of just in the beginning, just know that, you and babe are on that 24-hour cycle, every sort of 2 to 3 hours.
Yeah, this thing I'm on. But you have to see the screen? You can see the screen?
Okay, and then by 4 to 6 months of age, night feedings can be much less. Some babies can sleep 8 to 12 hours during the night if they've been conditioned to do so. And I'm using the words can or may, because it's really, sleep is a wide open space, and there's so many philosophies and parenting approaches. And so these are just what's possible, some expectations. Babe can be an independent sleeper if you've shaped that and conditioning has been established, or baby can be a signaler and reach out for parental assistance to get back to sleep. So there's lots of variety there. There's a whole range, and there's no right or wrong way to do that. A lot of parents ask me, why do newborns cry? So I spend a lot of time with my clients just kind of going over reasons why, because I think for new moms, it can be just really empowering to go through that list of what troubleshooting, so a lot of times, you get into a situation where it's like, oh, the baby's crying, here, just feed them. And that's not necessarily the case. So I like to take my clients through this list so that they can kind of go through a mental checklist to help troubleshoot as they're going through and seeing if it's something else that they can address. So hunger, obviously. That moral or the startle reflex can be a reason. If they're sleeping and they wake up crying, it might be that they did that. So swaddled babies, in my experience, in my industry, do tend to sleep longer. And there's a really great resource from a colleague in Portland, Oregon, 7swaddles.com, for all sorts of tutorials, all sorts of different climates. Because, here in Hawaii, a lot of people don't have air conditioning and they need cooler swaddling methods and techniques. So that's a really great resource you can check out. Obviously, pee or poopy diaper needs changing. Temperatures being too hot or too cold. I've had a couple of clients over the years where room was too cold. It's kept at sort of like 65 degrees. And as soon as we moved it up a little bit, baby started sleeping, because, they do the way our circadian rhythm in our brain works, that we do have a naturally biological built-in cooling mechanism overnight. And so our body does cool down in those early morning, midnight to sort of 5 a.m. Hours. And so optimal temperature for a baby that's swaddled in a nursery or a parent's room, is sort of 68 to 72, 75, depending on the swaddle. Looking at the environment, is there an obstruction in the bed? Are there teddy bears in the bed? Is there something, a mobile that's maybe distracting the baby? A lot of times I'm telling parents to remove things that baby can be looking at, waking up and getting startled by, or just distracted and then crying out. Is the room too light? Do we need blackout curtains? Are there lots of technology? Blue light is very stimulating, even through eyelids, and so that can wake babies up and things like that. So we like to do a full environmental check, and I take my clients through that. Digestive issues or reflux, that's very popular reason for crying and discomfort these days. Do they need to burp or be winded, or did they just spit up on themselves? And there's vomit everywhere in bed? Or is there a more complicated issue that needs to be addressed and have medical attention? Babies that are overtired or overstimulated, they cry a whole lot. And that's why we want to make sure that we're catching their sleep cues. Are they missing a relaxing sleep routine? Was the day kind of chaotic with older kids, or just lots of things? Now during COVID times, a lot of us are home, and that's been really nice for infant sleep. But, were there lots of things planned? Did the baby miss 2 of their popular morning naps? Do they need to just be held and worn and just calmed down and regulated that way, just to get through a sleep cycle? Our cortisol levels spiking, all of these things. Are the caregivers stressed or anxious? This is a big one that I talk about. Making sure that the whole household might need to take it down a couple notches and just mellow, because babies definitely feed off of energy of the household. Okay, and here's some effects of a sleep-deprived baby. The word deprived is a strong word and clinically indicated. I mean, this is a baby that really isn't sleeping. I mean, this is, if you have a baby, a 4-week-old baby that really is only taking, sort of 2 hours of naps a day kind of a thing. Like, this is a baby that really is not getting any sleep. And this does happen for all of these reasons, one reason or another. But baby obviously cannot settle easily, whether nursed or worn or rocked and shushed, all of those things. Babies can often have more feeding issues because you just get overtired, and a lot of times they'll just be and just crying and hands up. So it can be hard to settle them at the breast. Difficulty waking, which can have impacts and an association with SIDS, because they just, for whatever, if they're having any breathing type things or whatever, and their brain is just so tired. Stalled growth and development, missing milestones, lack of neural pathway development. Up to 85% of our neural pathways are established between the ages of 0 and 3. So sleep is a very important part of that brain development process. Our brain doesn't actually sleep when we sleep. In fact, the neuroactivity when we're sleeping is phenomenally active, and it's really a lot of restoration and development is actually happening when we are sleeping. And then long-term evidence of sleep deprivation, just in babies and adults, a lot of chronic illnesses, obesity, high blood pressure, heart disease, stroke, depression, etc. So long-term, if you're lacking sleep overall, we can start to see chronic things. And then just elevated levels of stress and anxiety for the household. People call me because they're like, I'm done. I can't do this anymore. Where no one's sleeping. Because obviously if a baby's not sleeping, the caregivers usually aren't sleeping either. And so this is just sort of why I do what I do, because we want to avoid this. And, this list is sort of the antithesis of thriving in postpartum. So there are so many resources out there to make sure that you're not experiencing any of these things. And so I'm super happy to be sharing these with you. And just some signs of a sleep problem. And again, the effects that I just listed on the page before, that's a sign of like pretty big sleep problems, right? Like most people we know are not experiencing those things. But if you as a practitioner or as a mama do know someone that is experiencing these things, definitely make sure that you have resources at your disposal to wrap support around them or to make referrals because of the long-term impacts and effects of that. So unexplained crying, we call that just colic, and just why that can be a medical issue, but it can also be, that overtired, overstimulation, and they just cry. I mean, I cry when I'm overtired too. I easily cry and quick to be sorrow and weeping. And so babies are no different. They're tiny humans. If they have no obvious pattern to sleep, again, that circadian rhythm is very strong. It's a very strong biological built-in mechanism that we were created with. And so if it's all erratic and you're not, after that sort of 6 to 12 week period, if you aren't seeing some sort of pattern establishing, then that might be a sign that there's an issue with sleep. If baby's always sort of agitated, grumpy, uncomfortable, that's usually a sign, because rested babies do wake up happy and generally have an overall pleasant temperament. Apnea episodes, if you have a monitor, if you're hearing, that kind of skipping breath where they're gasping really loudly in bed during their sleep, if baby is hard to wake, or if baby is waking stressed out and crying. So, the well-rested babies would, and those of you that are mothers already know this, you kind of unswaddle baby and they do that big stretch and they're happy and hi. They wake up from their nap that way. That's how rested babies wake up from nap time or bedtime. If they're waking up crying, that's a sign that, sometimes they would wake up crying, but if they're waking up crying routinely, like if every single time they're waking up crying, that's usually a sign that restorative rest isn't happening, or just on the whole, there's sleep deprivation or a problem with sleep. Okay, so I'm just going to go over again quickly. We're almost through here, and happy to take questions. A few sleep settling tips. This is just a small list of things that I like to go over with my clients, but just things that you can make sure you're checking as well. But is there an optimal sleep environment? You know, is it cool? Is it, you know, a nice flat, safe surface? Is it a dark room? Is baby getting sufficient milk, whether that's breast milk or formula, whatever the family's feeding situation is? Dr. Harvey Karp's 5 S's. Those are so popular and they work. So that's usually an easy go-to to refer parents to if they need a starting place. Paying close attention to baby sleep cues. Every baby has different cues, whether it's a yawn, a cry is usually way too late. You know, there's usually a progression of sleep cues. You know, they kind of tense up their thing and start putting their hands on their eyes, but just paying close to those and then making sure that you're getting baby to sleep prior to them being overtired. Especially in those first 12 weeks, it's really easy for them to go from, you know, awake to overtired if there's a delicate balance there. I like to encourage my clients for a number of reasons, and this is Thrive Postpartum, so I love that everyone's on the same page there, but prioritize sleep and rest in the first 6 weeks just to establish that solid foundation for baby, but also for birthing person, for mama. I love when moms tell me that they're just going to do their time in, they're settling in for the first 40 days, you know, just really healing and nurturing. I like to tell my birth clients and my postpartum clients, you know, your full-time job once baby is earthside is you looking after you, your rest and recovery, but also breastfeeding is going to take 8 hours a day, in a 24-hour period. It's going to take 1 hour every 2 to 3 hours, you know, by the time you do all the burping and the changing of the diaper and just kind of looking at your baby and establishing that relationship. So it's a full-time job. And then that first 6 weeks, that's all I want my clients to do is don't think about sleep. It'll happen naturally, you know, with shaping things, but really just establishing that breastfeeding relationship is all we really need to do. You know, have a calm, quiet sleep routine that leads up to naps and bedtimes. Babies love consistent routine. They like to know what's happening. I do too. You know, not everybody does. Some people love to be spontaneous, but babies in particular, the way that their brain is being developed, they love to know that routine. And so setting that up, having cues like, okay, we're gonna, whether it's a song or a phrase that you say or an essential oil roller ball that you use, and you're using aromatherapy to trigger that, you know, whether it's the swaddle or the white noise machine, whatever it is, they like to have that routine leading up to naps and bedtimes. And then again, just this managing household stress and anxiety levels. Babies do feed off the energy of the house. So when I go in, I also kind of look at the whole picture holistically and see like, how can we wrap support around a household that feels stressed. And of course, by the time I get involved as an infant sleep coach, a lot of times stress levels and anxiety levels are very high because of the lack of sleep. And sleep deprivation in adults, I didn't even talk about that, but you guys, I'm sure, especially those of you that are birth workers, you know how snarky and grumpy you can get with your household when you've had only 3 hours of sleep the night before. And there are households operating on 3 hours of sleep, and that is not normal. As a postpartum practitioner, what I do when I go into houses is I always say it's going to look different, but a good rule of thumb is what sleep you were getting prior to baby coming earthside. You need to make sure that you're getting that same amount of sleep in postpartum as well. It's not going to look the same. Yes, it's going to be broken, but in a 24-hour period, you need to be getting that same amount of sleep. So if mom is used to getting 7 to 8 hours of sleep in her pregnancy, she needs to be prioritizing 7 to 8 hours of sleep in postpartum. That's absolutely possible. And if it's not happening, then that's a sign of a sleep problem and a health and wellness problem, because she's probably got all sorts of other things going on if that's not happening. So this is just you know, a quick list of tips. And then some tips I like to give for implementing your routine. Just have a plan. Read books. I like to encourage my clients, you know, to read books and agree on your philosophy and your parenting approach. There is a whole wide spectrum. And that's why I like to just talk about infant sleep solutions. I don't align with or subscribe to or stick with any one sleep approach. I like to have a spectrum, and I like to educate on that. And for me as a practitioner, what I do is I say, what are your goals as a family, and what is your parenting approach and philosophy? So I can then coach and tailor your sleep routine and your plan for what your goals are, because some people maybe want to do attachment parenting and want to use gentle approaches, and they're going to have a family bed and bed share. Some people need to go back to work at 6 weeks, and they really do need to manipulate their baby's sleep routine, and they need to have baby sleeping 8 hours a night by 12 weeks. And that's absolutely possible, and that's fine too. And then everywhere in between. And so the main thing though is have a plan, and making sure that you think about this. I think it's my analogy for birth. As a birth worker, it's like we spend all this time, it's kind of similar to marriage. You spend all this time and thought and everything about like the actual birth, and then it's kind of like the wedding day, but afterward it's like, well, how many books did you read on marriage and how to make that work? Okay, well, making sure how many parenting books have you read to take care of this tiny human? So having a plan, keeping a log, making sure you're tracking things, and then just keeping consistent with your chosen approach, because there's so much change and development that happens daily, weekly, monthly. And so having a plan that way is going to help. And then I always tell people, call me if the DIY approach is too overwhelming, because a lot of times, just like birth, people hire a birth doula to coach them through because there's just so much information. People hire an infant sleep coach for the same reason. By the time their baby is born, or even in pregnancy, a lot of people will hire me in pregnancy to help them to set up that optimal sleep environment and to help them to create their plan and approach. Same thing. You have a coach because you want to, do the best job at helping to achieve your goals at what you're doing. And so infant sleep coaches can be really valuable for that. And then I always like to talk about this, especially since we have a range of like professionals watching and mamas, but when to seek professional help. So again, my whole premise for sleep shaping is establishing that breastfeeding relationship. So I love that we have IBCLCs on here. So I won't work with a family until they have their feeding issues completely sorted out, because I need to know as a professional that they know that their baby, that milk transfer is happening, that baby is getting all of the calories that they need, and that a relationship is established. So definitely if you're working with a family and you have an inkling that maybe baby's not, if there's something like maybe a tongue tie or whatever, you need some sort of evaluation, please refer them to an IBCLC. Postpartum doulas, again, if that 7 to 8 hours of sleep in postpartum is not possible for mom, or if it's just not happening, they might need a referral to a postpartum doula to just come and hold baby, or be the one to settle baby, or to do the laundry, or the meals or whatever, to make sure that they can actually achieve that sleep, because there are very long-term impacts on mom if she doesn't get that sleep in postpartum and that recovery time. So postpartum doulas can be really great. Making sure they dial in their nutrition. So I love that we have holistic nutritionists and dietitians, virtually helping people all over the country and the world. Physical therapy, I'm so glad that there's a PT, because pelvic PT, I refer all of my clients, because if mom's in pain, if she can't sit on the couch or the bed and lean back and feed her baby, if she's having severe sciatic pain, whatever it is, if her shoulder, if she gets de Quervain syndrome, whatever it is, and she can't feed the baby and rock them to sleep or whatever it is, we have a problem. So PT, chiropractic, again, making sure that the whole family, the whole household is in their optimal health or wellness, so that they can focus on this sleep thing. Postpartum counselor and therapist, again, by the time mamas often call me, anxiety levels are high because all of these things have not been looked after, and our healthcare system just fails moms time and time again, right? And so making sure that you have really good, solid counselors and therapists to refer mom to work through any PPA or PPD that she might have been experiencing. And then an infant sleep coach, so that's someone that can really help. And the benefits are lifetime benefits. I mean, the gift of sleep, I love to talk to my parents about, you're giving yourself and your baby the gift of infant sleep, and it's invaluable. And so this is just, I just kind of put this up here for those of you that don't know what a infant sleep coach does. This is just kind of what to expect. I kind of take you through a consultation. I do a video or in-home, and I look at just everything. I look at the whole nursery, the whole environment. I like to come into the house or do a video consult and see all the spaces. I like to know and listen, like, are there chickens that are cock-a-doodle-doo, or roosters that are, you know, cock-a-doodle-doing at 4 a.m. and that's what's waking the baby up? I need to know everything so that I can be the best coach and investigator to figure out what is happening here. And I do, you know, recommendations on products that you don't need. It's usually, I'm a minimalist, and usually it's what you don't need. Like, no, you don't need to buy all of these things, and this is all you need to set up an optimal sleep environment. And it's really just listening to the goals of the family. You know, what is it that you're trying to achieve, and being real about expectations, and then helping them to implement a plan so that they can have a safe and satisfying sleep relationship in the household, and take advantage of all of those benefits. And so, without further ado, thank you so much. That's the end of my presentation. Here's some contact info, and yeah, there's a you could sit in a class like this for 9 months, and this was just a really quick snippet. So thank you, Kirsten and Danica, for allowing me to participate. And yeah, to the gift of infant sleep. Thank you.
Thank you so much, Jenna. That was awesome. You were like busting through those.
I'm like, yeah, exactly. It's 8 o'clock now, half an hour. Boom, done.
On the dot. After this retreat is over, there's going to be an email going out too that's going to connect you with Jenna Clarke if you want to know more, or if you want to, reach out to her. She's amazing. So those will be going out here in a little bit. We do want to open it up for any Q&A for Jenna or for Danica and I, if you have any. So if you do, just pop yourself off mute and we can answer those now. Oh, and Jenna, would you be able to switch the host back over to me, please?
Yeah, I wanted to say real quick, all of these professionals who are speaking, they're going to be having a portion in our Thrive course. So that goes more in depth. This is kind of a quick overview, and you have access to them. You can reach out to them, and if you need personal infant sleep coaching, you can reach out to Jenna personally to work one-on-one and all of that. We're bringing these professionals to you so you can reach out to them one-on-one and work together for your specific needs, because we can be educated on something, but sometimes we just need that one-on-one work to really get to the root of what we're going through personally. So
yeah, that's so true. Jenna, it looks like there's a question for you. It says, for naps, do they have to be done in the dark room during the day?
No, that's a really great question. No, because naps can look however they need to look. I like to do, when you're implementing an approach, like if, say, baby's 4 months old and it's like, I need help, and it comes to me in a plan and we're implementing an approach, I like to say like 80-20. If you can stay home and do the good naps for 80% of the time. Some people choose not to do a dark room because they want baby to just be used to. But I will say, but babies just do sleep longer. I mean, we all do. If in a white, cool, dark room with white noise blasting, like, that's a hard one to beat. So no is the short answer, but if you're trying to elongate those naps and get those 1.5 to 2.5 hour naps that are possible, if you shape it that way, then sure, yeah. Like, I'll often use dark rooms unless a family chooses not to implement that tool.
Awesome. Thank you so much, Jenna. And thank you to Ports for asking the question. Are there any other questions before we go ahead and conclude this? I don't see any coming through, but if there are any that come through, no worries. I'll pop on and bring those to attention. But I'm excited. Tomorrow is going to be Dr. Devanya. She's a physical floor therapist. My son is hungry, so I'm going to wrap this up. But she's amazing. I'm so excited that she's going to be on here. The link will be sent out again via email in the morning and again tonight. I'm just sending the link out a million times because moms don't need to be shuffling through emails. We want to click and do it, and that's it. So hopefully it's easy. And then again, Jenna's information is going to be available in your email as well. And we'll see everybody bright and early Hawaii time and in the afternoon for everybody else tomorrow. So thank you so much for being on here. And I love all of you. Yay. All right, my friends.